Lakeland Currents, your public affairs program for North Central Minnesota. Closed captioning is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org.
Hello again, everybody. I'm Ray Gildow, co-host of Lakeland Currents. Today I have a very special guest, a person who is pretty new to her job and is doing a fantastic job. Bjerga is the CEO and president of Lakewood Health System in Staples, and where else? Where do you have your clinics?
Yes, we have clinics in Pillager, Motley, Eagle Bend, Browerville, and then a dermatology clinic in Sartell as well.
Wow. And how long have you been on this job now, Lisa?
I've been on this job for 2 years, but I've been at Lakewood for 16.
And you did what before that?
So my background is in finance. I'm a CPA by training, and so I was in public accounting from the St. Cloud area. Moved up to Lakewood, was hiring someone in their finance department right after they expanded to the new facility that we're in now. They had a lot of growth that year. And so I started as an accountant in 2008, and then that evolved into finance director, which then evolved into revenue cycle director, and then I was chief financial officer for 7 years. And during those 7 years, the last year and a half, 2 years, we did a pretty extensive search and succession planning process under Tim Rice, who was our CEO for 42 years. So I had the opportunity to shadow and train right with him. And then at the end of 2022, moved into this role officially. So
you're pretty unique in that a lot of people in finance are natural leaders, but you are a natural leader. I've heard that from so many of your doctors that are so pleased with how you just stepped in and took over for Tim, who did a phenomenal job for 40-some years, but you didn't miss a beat. And I think that's a real tribute to your leadership. And tell me, what are some of your skill things that you focus on as a leader at the hospital?
So when I came into the role, the 3 areas I wanted to really kind of have as my main themes were relationships, focus, and alignment. And so I took time right at the beginning to really focus on that relationship piece. And so I went and shadowed within every department across our system. Really? So I got up at 2 a.m. and went in with laundry and folded laundry and saw what their routine was, and to better understand each of the positions and their roles.
That's impressive.
So then you can best support it.
Sure.
I don't like to micromanage, but when somebody comes to you and says it's super busy in our department, I kind of have a recollection of maybe what that busy looks like. Shadowed an ER doctor for a shift to see how that all looks, and watched the nurses, of course, and the techs and everything going on with that. Rode in the ambulance, followed maintenance around, just to get a flavor of what everybody's roles are. In healthcare, we have everything from, everybody thinks healthcare is doctors and nurses, but in healthcare we have IT, we have human resources, we have dietary, we have maintenance, and so just to get a better understanding of all those kind of specialties and what that looks like on a day-to-day. And that was fun. I learned a lot.
I bet you did. How is funding pretty stable for rural hospitals now? Are you in a pretty stable period?
Obviously politics can change things here and there, but we are a rural healthcare system, so we have a critical access and rural health clinics, which is basically a designation under Medicare that is, I would say, relatively stable. Our commercial contracts, those are the ones that we have some negotiation power, but overall our reimbursement is not increasing. We're still in declining reimbursement with inflationary environment, and so those two things aren't very favorable when put together. Yeah,
I'll bet. And when you look at your site, do you have 4 sites off campus?
And then plus we have the assisted livings.
Okay, yeah.
And then we have the long-term care facility.
And so how many staff do you have when you put all those together?
We are almost hitting 1,000.
Wow.
We have 900 and some, and then also when you add in the physicians with that, we're almost at 1,000.
Wow.
So this past year we grew a lot. We kind of hovered right around that 800 mark, but with the oncology service line expanding, that's added a lot of staff, as well as orthopedic growth. And then when we acquired Longbella Drug, that really increased our FTEs as well, or our employee numbers.
So you have Dr. Wade Swenson, who is the oncologist who came. He's also my doctor, very, very excellent doctor, by the way. What is it he's doing at the hospital that's new?
So he's our oncologist. He brought a whole team with him when he came to Lakewood and bringing in the oncology program. But not only is he focused on oncology, he is very, very passionate about rural oncology. He feels that your zip code should not dictate your outcomes, and oncology is a specialty where people in rural areas travel the furthest distance for their care. And usually you're talking about very frequent trips and long duration, and so overnight stays. And so he's very passionate about how can we create a model, maybe a hub and spoke, or what does that look like when we have some outreach where we can really build this care management piece of oncology alongside with our oncologists to hopefully care for the greater part of Minnesota, not just urban Minnesota.
I have some doc friends who are not part of your system who follow him just because he's such an innovator for rural issues, not only rural Minnesota, but I think he's been a kind of a leader in rural issues across the country.
Yeah.
So that's really saying something. So you're building a new oncology center. When is that expected to be functional?
In about 11 months, so September of next year. Yeah.
Wow. You've had a great fall for working with no rain.
We have. We had some rain at the beginning, but I think they've had some good weather to catch up, and we should be enclosing it shortly, so the winter weather won't impact that. But yeah, with that, we're going to be able to double our infusion bays. So a couple of years ago, we actually increased the space of our infusion area, and that was right before we onboarded Dr. Wade Swenson. And the first time he saw it, he said, "This is too small. We're going to outgrow it." And we did. And so we're doubling the infusion space, but we're keeping our current space to do for non-chemo patients. And so our chemo patients will be within the cancer center. Also adding radiation oncology. So we'll have radiation, a linear accelerator will be within that space. People can see it looks like we're building a vault out there right now because they have to have some pretty thick
a lot of concrete.
Yes, yep. I think we had 32 trucks the one day.
Wow, just with concrete?
Yep.
Wow.
Yes.
So when you look at the growth that's going to come, because I know there's already patients coming from the metro area to this city, to the oncology center. That's amazing. Is that word of mouth? Is that how that's getting out?
Yeah, I believe so. I mean, we have a really good patient base with our primary care docs that have built that local patient base, and then they're spreading the news to maybe their friends from the metro or their family that lives an hour north or an hour south, and so bringing them to Lakewood for that level of care. Most recently, we brought on Dr. Emily McGovern. Was Emily Westergaard. She recently got married. So she's the second oncologist that we've added to the team, in addition to 3 PAs that we have. And so ready to really absorb that additional volume that we're going to see.
And how many beds do you technically have?
We have 25 inpatient beds.
Okay.
That doesn't count, if somebody's in observation or if somebody's in outpatient status. And so 25 actual inpatients. So when somebody has a surgery, say a knee surgery, and it's more of an outpatient status, they can be in a bed, but that's not part of that 25.
How difficult is it right now to get doctors in rural areas?
So at Lakewood, we've been very, very blessed on that front. I would say if you were to ask most facilities, it's a very, very much a challenge. But we have the Rural Physicians Program, Rural Physicians Associates Program. The RPAP is what we call it. It's through the University of Minnesota, and basically students, they're in their third year of med school, come out and they spend their third year at Lakewood. So that serves as somewhat of a pipeline for us. They get acquainted with us, we get acquainted with them. They also speak to their network. We've had Dr. Benson was actually our first RPAP student that became one of our providers, and so we've had that program for several years. Right now, we have 2 that are within the facility. In addition to that, because we've been so successful on the RPAP front, shoot, my phone's ringing. Sorry.
Oh, it's okay.
Okay. So because we've been so successful on the RPAP front, we actually got contacted by the University of Minnesota this past year, and they would like to do a rural residency program at Lakewood.
Is that from the main campus at the U?
Yep. And so they will do the residents will do their first year residency at North, and then years 2 and 3 will be at Lakewood. Wow. So in the first year that we're up and running, which will be 2028, we will have 2 residents, and then in 2029 we'll have those same 2 will be in their last year, and then we'll have 2 second years.
How challenging is it? Not that you expect everybody to live in Staples, but how challenging is housing when you bring in new people?
Very. That's probably one of our biggest areas. And again, when you look at healthcare, you have every kind of set of wage. You've got entry-level positions all the way through your providers, and so different levels of housing are also needed. And so it's hard to have this inventory that's going to be just perfect for whatever we're bringing in. We do incentivize our providers to live within the school district because we really want to make sure we're supporting our core service area, Staples Motley. We've been part of the solution to some extent when there's a shortage of housing. We partnered with a local builder and then Central Building in Staples, and we built 4 houses. I mean, it's only 4,
really?
but it's 4 more within the community. 3 of those have sold. Right now, the last one is on the market, listed for sale. So when we bring in potential recruits, we can show them the options, and maybe even it's a temporary option for them until they decide we want to live in the woods, we want to live on the lake, the river, what part of town they want to live in. Additionally, last year we built the plaza, so that's the commercial building just west of Ernie's in town, and that has 11 apartments up above. Those were filled, we opened in January, and they were filled in February.
Really? And I know you've kept a few, haven't you, for visiting?
Yep. We've retained 3 of them for ourselves. Yeah.
And the hospital for a long time has had a great reputation of working in the community. Talk a little bit about the Nest and what you're doing there.
Yes. So the Nest is basically, it's a collaboration with Lakewood Health System and Staples Motley School District. We pooled our funds, so the school was going to do some renovations, some enhancements to their facilities, but in order to make that really impactful, we pooled our funds together, and what we've been able to do is the south gym that existed, expand that and make it a true competition gym with bleachers.
So that'll be the main gym for basketball?
Yep. They're going to call it the Nest, and then they'll call the old gym, if you will, the Legacy Gym. And so they'll have 2 places to have actual competition with spectators.
And then is there a weight room involved with this too?
Yeah, so up above the Nest gym is a walking track. It's just under 1/10 of a mile, so about 10 laps is a mile, and as well as a fitness room. And then there's a student weight room that can be used. And in the fitness room, there'll be some pieces of equipment, bikes and ellipticals, things like that, as well as programming where there'll be classes that you can take. So people can purchase memberships to the Nest. We have the ribbon cutting on December 2nd. I was just in there the other day. It's very exciting. It's great to see because what that can do for the school district, the community, our patients, it's great to see.
Is the Nest connected to the cardinal theme of the high school?
Yep.
Okay.
Yes, one thing we've discovered is red and orange don't go together very well. So we've tried to kind of sprinkle the Lakewood orange throughout a cardinal gym.
Okay. What are some other things that you're doing in the community for wellness?
So we're active on so many fronts. On the wellness front, I mean, obviously the Nest is our biggest initiative just because that's where people can get active and they have a safe place and a warm place in the winter. We have a lot of efforts around food insecurity, and so we do clinical screening for those that don't have access to food or have a fear of not being able to afford food. And so we actually, the clinical screening then drives once a month. We have food shares for them to pick up at Lakewood. During the summer, we do it through our farmers market out in our parking lot. I don't know if you've seen that.
Yep, I've been there many times.
Lots of vendors who come, and so then those same individuals can get market bucks and get healthy access to food there, as well as then once a month, like I said, in the winter, they pick it up at the senior campus. That's available to our employees as well, and so there's no stigma for who's picking it up. It could be, a provider's picking it up, and then there's somebody who in the clinic screen that they couldn't afford, or they're worried about affording their next meal.
Sure.
We also have Cardinal Packs, which is a program that I think is just great. We do receive assistance from some of our local businesses to help us pack backpacks for the school. And basically,
With food?
Yes, yeah. It's so the school has identified students that they feel don't have access to food on weekends, and so we put some food that's available for them. You know, it's hard to get healthy options that are shelf stable, but as healthy as we can get, that can go, toss it in their backpack, and then they have something to eat over the weekend.
So you're doing a lot of things in the community. Do you do things in the communities where you have your clinics?
We do, yep. So obviously Staples is where we have the biggest clinic. It's where we have our home base. Most of our patients come from there, but Pillager as well. We've helped their school enhance their weight room with our partnership with Twin Cities Orthopedics. We provide their training program as well as at Staples. We provide the athletic trainer there as well. Browerville, we're active in other communities that we do have clinics as well. I think Browerville, we've pulled some of their athletes to be part of our billboards for Twin Cities Orthopedics. But yeah, and there's constant things here and there as far as can you help support this booster club or help support this initiative that a lot of times we're behind the scenes, but we're definitely present around all the communities.
Talk a little bit about your relationship with Twin City Orthopedics. Mm-hmm. How did it get started up in Staples?
Yeah, so we were looking to expand the amount of coverage that we had for orthopedics, and just because we didn't have 5-day-a-week coverage, and so we're looking to expand that. Twin Cities Orthopedics was looking to expand to the northern market, and so kind of by luck, started a discussion around that, and things moved forward. How it works is initially we had 4 TCO docs that would rotate 1 week a month. They would come up and they would work out of our clinic. They worked, as a TCO doc, but they would bill as Lakewood and part of the, the Lakewood team. We now have Dr. Paul Diekman, who has become full-time at Lakewood. So he's there every week, living, just bought a home in Staples. His wife and son have moved up here as well, or will be moving up here. I think they close in the next couple weeks.
Wow.
So he's here full-time, and then we have 3 others that rotate. And so then looking to secure another full-time down the road. Our goal is to find providers who want to work and live in the community. And so that's our goal, to secure another one of those as well.
What is it that's making the innovation so strong for the hospital system? Is it your board? Is it the community boards? What's driving this? You're doing really some unique things.
I think, we just keep our ear to what is needed, what service lines are not met in our community. I think, for patients to have to drive for those services, if we can responsibly get that specialty or that service line at Lakewood, and I mean responsibly by, we don't want to bring in a neurologist that we only have 1 day of volume for, making sure that we can bring that in and there's a true need for it. And so just constantly looking for how can we grow, not necessarily grow to take over a larger footprint, but how can we deepen that to make sure we have all those service lines so people can stay close to home. And then it also creates economic development for Staples, brings in, more employees, which is more patients, which is more business in Staples. And so I think it's, Lakewood, their success story is really a little bit of everything. You can't just have one piece. We have phenomenal doctors who provide that personalized care that really get to know their community. Again, they're part of that community. You've got employees who are absolutely engaged and care about their patients like their family, because quite often they can be family. Mm-hmm. And then administration and a board that supports, maybe some out-of-the-box ideas, and we'll try it and move forward with it.
I've been around a long time. When I started at the hospital, there were 2 providers, and you know who they are. Mm-hmm. And how many do you have now?
We have over 30
wow.
MDs and about as many APPs as well.
Wow. Mm-hmm. So you got 60
yep.
professional level people
yep.
there. That's amazing.
Mm-hmm.
Really is amazing. And I talked to a number of those folks, and they're so pleased with the organization. For one thing, you're not a big corporation,
yeah.
Which is something that a lot of doctors are trying to get away mm-hmm. from, I think. But it's just it's a real success story. It's really exciting to hear. Mm-hmm. And when you look at down the road, what are you looking at? Are you doing things in telemedicine?
We are, yep. I think with COVID, there was a blip of that. I think it's a good enhancement to a service line, but it definitely doesn't take the place of that provider. Some specialties, we will use that more just because, again, it's hard to get that specialist out to Lakewood. we use it, I think, as a backup. It's not our primary route, just because I think for Lakewood being so personalized in our approach, giving that whole comprehensive suite of care, if you will, it isn't the best approach, but it absolutely is a good option.
And I notice you have people circulating around in the hospital. You don't have sometimes the receptionist is different every day.
Oh,
and,
yep.
and that's one of the things I hear that they like, that they're not locked into just one thing all the time. It's kind of unique.
Yep,
Yeah.
they can kind of job share or rotate into different positions for the day. Yeah, we have
And
check out and check in.
I heard through the grapevine, even on some Saturdays, you bring in donuts or bakery goods.
We do sometimes. Yep. If
Is that part of your healthy foods?
Yes.
Yeah.
I will
okay.
make bran muffins, so I'll say that's healthier.
There you go.
Yeah. The one thing, people like food, so if people gather around food, bring that in and thank everyone.
And let's just talk a little bit about your robot. You have a robot. What does that robot do?
His name is Timmy. We had a little naming contest, and it was right when Tim Rice was retiring. And so we moved our lab. It used to be located on our main floor, and so our lab was busting at the seams with all of our growth, and so we had to move it to a new location. And with that, it became a little further away from where draws would happen, so the ER up in the clinic. And so instead of having a person go back and forth, and this was 2020-ish when staffing was really tight, we got a robot, and he goes in the elevator and goes up to ER and picks up, they put the samples in, and then he goes back and, prevents us from having a person to run back and forth. He doesn't talk back much, he's good, but he does have issues.
I've seen him a few times in the elevator.
He has blocked the elevator from time to time, but no, it's great.
Yeah. We're really blessed from Aiken to Perham with some really good hospitals. Do you folks work together?
We do. We actually have a CEO call every Monday. I would say between our group of independent systems, probably half of us are on each Monday. Sometimes it's just to say, how are you doing today? Sometimes there's actual, agenda or topic to discuss. But we know that the key to independence is collaboration. How can we work together? It's maybe sharing a specialist. It's even support services. When you look at a coding service line, is there a specialty that maybe we don't have enough for one coder to do, but two of us do? So some shared services or looking at how are you handling this, there's definitely collaboration amongst the area.
And you have a board. How do you select members for the board, and how big is your board?
So we have two boards.
You have two?
Yeah, we are Lakewood Health System is a 501c3 nonprofit. So we have an appointed board that 4 of the roles are filled with physicians that come from the physicians group, and the rest are appointed, kind of a typical board where you try to get someone in finance, maybe somebody in retail. The history of Lakewood is that originally it was a district hospital. And so there are 10 townships, 2 cities that came together and said, healthcare is important. We want to make sure we have a hospital. So the United Hospital District was formed. They basically own the real estate, and each township elects a member for that board.
Okay.
Lakewood Health System then leases the real estate and operates Lakewood as a business. That all happened. Lakewood Health System was developed when we basically acquired the physicians group, the Lakewood Clinic in town.
I know expansion and innovation costs money. Do you have some long-range plans of things you'd like to see coming down the pike?
Yeah, obviously the Cancer Center right now is our biggest capital that we have in front of us. I think looking at, again, you asked, how many beds can we have? That will always be 25 as a critical access facility. That's the most we can have. But how do we expand those outpatient beds? Because with oncology becomes more inpatients. We see people are getting sicker, in the hospital. And so how can we expand our capacity to make sure we're meeting those day-to-day outpatient needs? So I would say something around the outpatient front. I couldn't do this interview without sharing that we deliver over 500 babies a year at Lakewood.
That's incredible.
Which is, in a town of 3,200, we're delivering 500 babies.
Is that the population now?
I think that's what the sign
says. I've never been able
says.
to pin that down. Yeah, it's over 3,000.
Yeah.
That's incredible.
Yes.
And I've noticed in the papers, they come from all over.
They do.
Not
It's an
just
absolute
Staples
draw.
people, yeah.
And people always ask, what started that, or how did Lakewood build that when you hear so many other facilities are closing their OB? And again, I don't think it's one single thing. We were, it really started to build when we built the new facility and we brought on Dr. Ullman. But really our family medicine doctors deliver babies as well. And so they're a piece of that number, the 500 number, they're a very key piece of that. And so I think it's the whole program. You've got nurses, again, who care for their patients just like their family. And that's where I delivered both my boys.
Wow. I have friends in Nisswa who came down to have their babies delivered here. Like the hospital so much, they brought all their business down.
That's what
from
happens.
Nisswa. Yeah. And if you walk in the parking lot, it's just amazing to look at where the license plates are coming from. I mean, they're coming from all over. It's just, it is absolutely amazing. Well, we're about out of time. You're doing a great job.
Well,
How do people find out what you do? And do you have a website, obviously?
We do, yeah.
Yeah, could you just tell us a little bit about your website?
So lakewoodhealthsystem.com, we kind of run basically our updates across the top, but we have all of our service lines and our providers out there. I would say if you're looking for more real-time updates on what's happening at Lakewood, probably on social media, Facebook, it would be where we do the more real-time updates and kind of what's happening at Lakewood. Try to do some employee shout-outs or, even from a recruitment perspective, if somebody's looking to work at Lakewood, not just be a patient at Lakewood, how do we highlight and showcase really the fun things that happen at Lakewood? We have an amazing culture, and we want to make sure we capture that.
It is. It really is. Well, you do a great job.
Thank you.
We're out of time. Thanks for jumping on with us again, and good luck the rest of the year.
Well, thank you.
You've been watching Lakeland Currents. I'm Ray Gildow. So long until next time.